Pelvic bone is also called innominate bone, coming from the Latin word os innominatus, which means unnamed bone. And it's been treated this way because while they were naming bone, they couldn't find a familiar object that looks like this bone, and to them sounded like kind of crazy, like we've never seen a crazy thing like this. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time seeing this channel, don't forget to subscribe. Today we're going to talk about the bony pelvis. And bony pelvis is a ring of bone which is formed by four bones. Four bones are coming together to form the bony pelvis. What are they? You have two pelvic bones, right pelvic bone and the left. You have the sacrum and coccyx. Together they're forming the bony pelvis. And actually the word pelvis means basin. What the function of the bony pelvis? Number one is because they are bones, they should protect. So the very first thing that they're doing is protection, and they're protecting the viscera which are sitting within the pelvic cavity. These are the pelvic viscera. But they also support the body weight. How? Listen, we have the axial skeleton here. The sacrum is the part of the axial skeleton, but the pelvic bones, the pelvic girdle, they are part of appendicular skeleton. So the body weight is being transferred from the axial skeleton to the appendicular skeleton within the bony pelvis. So this is why we say the supportive function. It connects the lower limb to the axial skeleton, and so it transfers forces from the lower limb to the upper part of the body. Like when you are moving, what moves is actually the lower limbs, but they are transferring this force to move the whole part of the body. But also you have the, they're supporting the, the body weight is coming from the axial skeleton and being connected to the appendicular skeleton by the way of the bony pelvis. But we see that we have a lot of muscles that are attaching to different parts of this bony pelvis, so it serves as the, point of muscle attachment. But also the supporting this bony pelvis in female, it provides support during birth canal, like vaginal delivery, during vaginal delivery. So we have the pelvic girdle, and the pelvic girdle is formed by a pair of pelvic bones. Remember, we have said you have four bones that are coming together to form the bony pelvis. You have the pelvic bones left and right, but also the sacrum and coccyx. But the pelvic girdle is a pair of pelvic bones, left pelvic bone and right pelvic bone. This pelvic bones are also called hip bones. So this is also called hip bone, but it's also called ossa cocci. So we have ossa cocci or hip bone. Ossa cocci or hip bone also are called pelvic bone, and a pair of pelvic bones are forming a pelvic girdle. And the pelvic girdle, just like the shoulder girdle, they are connecting the axial skeleton to the appendicular skeleton. But they themselves, they are part of the appendicular skeleton, and they are connecting to the lower limb. You see, you have the femur, and femur on this side and this side are connecting to the pelvic girdle. The pelvic girdle is a pair of pelvic bones. What are the pelvic bones? This is the pelvic bone. This is one pelvic bone. Actually, this is the right pelvic bone. As we've said, there's got a number of names. It can also be called the hip bone or the coxo bone. It is also called innominate bone, coming from the Latin word os innominatus, meaning unnamed bone. Why unnamed bone? Because they couldn't find a familiar object that looks like this bone. But actually the pelvic bone is made up of three individual bones. Three individual bones are coming together to form a pelvic bone. Not bony pelvis, pelvic bone. What are they? You have the ilium, ischium and pubis. They are connected to one another, and they're being connected. They're coming together within the acetabulum. The acetabulum is the socket, the bony socket that is going to accommodate the head to form the ball and socket joint of the hip. So the hip joint is actually formed by the acetabulum, this bone socket, and the head of the femur. But within the acetabulum, you have like these three bones are coming together, and they're being connected by a cartilage. This cartilage is called the triradiate cartilage, and it's forming like this Mercedes-Benz and Mercedes sign. So you see the triradiate forms like something like the Mercedes sign. What are the bones? One more time. You have the ilium, ischium, and pubis being connected here by the triradiate cartilage, and this is usually a cartilage, and it fuses around for 23 years of age, meaning if you are still a teenager, there is like a high likelihood that your pelvic bones haven't fused yet to form a single bone, to become a single bone. But actually it's got three parts. So we start with the ilium. This is the ilium, and the ilium has got the ear, The ear of the ilium is called the ala. So ala means ear or wing. So it's considered as a wing. So this is the wing of the ilium, but it has got a fossa here. This depression is called the iliac fossa. Iliac fossa. So you have the ala of the ilium, iliac fossa. You have the iliac crest. The topmost surface of the ilium is called the iliac crest, and the iliac crest is extending anteriorly to become a prominent here. This prominent is called the anterior superior iliac spine. So it's a spine, but it's found on anterior superior surface of the ilium. So anterior superior iliac spine, abbreviated as ASIS here. But because of the anterior superior iliac spine, also have anterior inferior iliac spine. This is anterior inferior iliac spine, just below the anterior superior iliac spine. And then we have the body, also the body of the ilium. Let me show you this picture here. So this here is the ilium. This is the ilium. The ilium, we've said here, is got the ala of the ilium, and we have the depression of the ala of the ilium is called the iliac fossa. We have you have the top surface here, which is forming the iliac crest, and the iliac crest continues anteriorly to form the anterior superior iliac spine, and then also have the anterior inferior iliac spine. We've said we have the body of ilium somewhere here. This is the body of ilium. Now the body of ilium is meeting the ala of the ilium to form the arcuate line. I'm going to see later the arcuate line. Okay, but we have the rough surface. On the medial surface of the ilium, which is called the iliac tuberosity. Actually, tuberosity means rough surface. Here is where it articulates with the sacrum to form the sacroiliac joint. The sacroiliac joint is the joint between the sacrum and the ilium. And what part of the ilium, to be specific, that is iliac tuberosity. Now, if you are tracing the iliac crest posteriorly, it's going to end by forming another bony prominence or projection, which is called the posterior superior iliac spine. Remember, you had anterior superior iliac spine here. Posterior, you have the posterior superior iliac spine. Okay, but because of posterior superior iliac spine, you also have the posterior inferior iliac spine, posterior inferior iliac spine. And then one among the important things to remember in the ilium bone, in the iliac bone, is that you have this notch, which is a depression, a U-shaped depression, and it's called the greater sciatic notch. Very, very important, because here is where the sciatic nerve passes. Here is where the sciatic nerve passes. So these are the parts of the iliac bone on the medial side. On the lateral side, you can also see this is the ala of the ilium. I'm repeating, this is the ala of the ilium, which means the wing of the ilium. By the scotic surface, the anterior surface is it forms a fossa, which is called the iliac fossa. But posteriorly, we have the gluteal lines. We have the gluteal lines. You have the anterior gluteal line, posterior gluteal line, and the inferior gluteal. These are very, very important for the attachment of gluteal muscle. You have the gluteal maximus, medius, and minimus. They are attached. They're coming from these inferior gluteal lines. Okay, we're going to discuss them later, but we've seen the posterior superior iliac spine, posterior inferior iliac spine, anterior superior iliac spine, and anterior inferior iliac spine. We've seen the body of pelvis, the body of ilium. Now, what is so important, we've said all these parts of the pelvic bone that are meeting within the acetabulum, they are contributing a part of the acetabulum. So you see, part of the acetabulum being formed by ilium, part formed by pubis, and the other one formed by the ischium. Of the three pelvic bone, the ilium is the biggest. You can see the ilium is the biggest of the three pelvic bone. Okay, that's another view. Now let's move to the ischium. So the ischium forms the posterior inferior part of the pelvic bone. This who is a pelvic bone, and this is ilium, this is ischium. The ischium is formed the posterior inferior part of the pelvic bone, and it's been connected to the pubis, and also to the pubis and the ilium. The pubis is connected by the way of we're going to see a little bit here. So one more time, this is the ischium. And the ischium, what are the major parts of the ischium? The ischium has got the body. So this is the body of ischium, and this is a ramus. The word ramus means branch. So this is the branch of ischium. Body of ischium and branch of ischium, or the ramus of ischium. But we have two important bony prominences on the ischium. The very first one is called the ischiospine. We have only one ischiospine. This is why we don't have the superior or whatever. This is only one ischiospine. Okay, but we've seen the ilium have four iliac spines like superior, inferior, anterior, and posterior. Yeah, so this is the ischium and the parts of the ischium we've seen. Another bony prominences on the ischium is called the ischiotuberosity. Tuberosity means rough surface, and this is very, very important. And by the way, we have a lot of muscles. Maybe the hamstring muscles are coming from this region, and it's called the ischiotuberous. We're going to see these muscles in great details. But we have a small depression here. The small depression here, which is called the sciatic notch. The lesser sciatic notch. We have seen the greater sciatic notch on the ilium, but the lesser sciatic notch is actually found in the ischium or ischio bone. Okay, we have two sciatic notch, the greater sciatic notch and the lesser sciatic notch, and these are notches mean that just depression, and they will later be converted by ligaments. The ligaments will pass here to convert this notch into foramen. They also convert this notch into foramen. And lastly, we have a foramen here, which is called the obturator foramen. Obturator foramen is the biggest or largest foramen of the skeleton. Largest foramen of the skeleton. I know you guys might be remembering the foramen magnum. The foramen magnum is the largest foramen of the skull, but the largest foramen in the human body, that will be the obturator foramen. Okay, and it's called the obturator because it's been covered by a membrane, so it's obscured, like, I don't know, something like which is covered, and it's called the obturator foramen, largest foramen. Okay, so the lateral side of the ischium, we see we've said we have the body of the ischium, you have the ischiospine, you have the ischiotuberosity. We've said we have the ramus, the ischioramus, the ramus or branch of the ischium. The ischium is nicknamed as sit bone because this is a weight-bearing bone in sitting position. Like when you are sitting, the part of the bone that is bearing your whole weight is the ischium, but to be specific, that's going to be the ischiotuberosity. Now let's discuss about the pubis. Now pubis means adulthood. Remember puberty, adulthood, right? And it's called pubis because you're sitting on found on the pubic region. So the pubic bones has got two branches or two ramus. Has got the superior pubic ramus and the inferior pubic ramus. The inferior pubic ramus is gonna join the ischioramus together. They form the ischiopubic ramus. So the ischiopubic ramus is actually a connection between the ischioramus and the inferior pubic ramus here. And then we have the superior pubic ramus, as I've said, and the superior pubic ramus has got a ridge, and this ridge is called the pectineurine, also called the pecten pubis or pectineurine. And later we're going to see that this pectineurine is going to join the arcuate line of ilium, and together with that some other parts that are forming a pelvic brim. We're going to see what the pelvic brim is. So this is superior pubic ramus, inferior pubic ramus. We have elevation here, just lateral, lateral to the pubic symphysis is called the pubic tubercle. This rough elevation, and this is very important because with some of the structures are touching from here. For example, we discussed about the inguinal ligament. The inguinal ligament is coming from the anterior superior iliac spine to the pubic tubercle, and this is very, very important for attachment of different structures. But the left pubic bone is connected to the right pubic bone by the way of the pubic symphysis, and you have the rough surface here for attachment of pubic symphysis. We remember the pubic symphysis is secondary cartilaginous joint, which means it's formed by the fibrocartilage, the symphysis kind of joint. And then we have the pubic crest somewhere here, pubic crest. Let's see on the lateral surface. On the lateral surface, this is the pubis, and we have said that got superior ramus and the inferior ramus, and has got the pubic tubercle and pubic crest. You have the pectineurine on the medial side. On that side you cannot see. But also remember that the pubic bone is also forming a part of the acetabulum, as we have said already, but the pubic bone is also forming a part of the obturator foramen. Now obturator foramen is formed by two bones. Two bones are coming together to form the obturator foramen. That's going to be the ischium and pubis. And here anteriorly, inferiorly have been covered by the ischiopubic ramus. The ischiopubic ramus, as we have already discussed. Now this is your pubic bone, left pubic bone and right pubic bone. You've said left and right pubic bone are being connected by the pubic symphysis of symphysis pubis, and this is secondary cartilaginous joint. And just below this joint we have an arch, and this arch is called the pubic arch. Pubic arch is also called the subpubic angle. We're going to see how important this angle is, and a lot of structures we have already discussed here. Time to discuss the pelvic brim, and the pelvic brim in this continuous ridge that forms the pelvic inlet, and posteriorly it's been bordered by the sacropromontory. As you're moving laterally, you have the ala of the sacrum, and then you have the arcuate line, the pectineal line, and the pubic crest, and anteriorly, the most anterior part is the superior part of the pubic symphysis, together forming this pelvic brim. Let's talk about the greater and the lesser pelvis. The greater pelvis is also called the false pelvis, like this is not the true pelvis, and the lesser pelvis is what is considered as a true pelvis. But these two, they are being separated by the pelvic brim, the pelvic inlet, separating the greater pelvis from the lesser pelvis. Now, the greater pelvis is also called the false pelvis because this one does not really cover the abdomen, the pelvic viscera, but rather it covers the abdominal viscera. And the lesser pelvis is considered the true pelvis, which actually means the pelvic cavity, because this one is what covers the pelvic viscera. The pelvic viscera being expected to be found within the true pelvis, and this is why it's called the true pelvis. And the true pelvis is spanning all the way from the pelvic inlet to the pelvic outlet. Wow! So we have pelvic inlet and outlet. Let's see. We have already seen the pelvic inlet is being bordered by the pelvic brim. The pelvic brim marks the entrance to the true pelvis. Now the pelvic outlet means you are moving out of the true pelvis. You are going to the perineum now, and it's being bordered posteriorly and inferiorly. The pelvic inlet is bordered by, you have the coccyx here, and then you usually have a ligament here, which is called the sacrotuberous ligament, and then you have the inferior, the ischiopubic ramus, as we've seen, the ischioramus and the pubic ramus. You have the lower part of the pubic symphysis is the forming pelvic inlet, and the upper part of the pubic symphysis is forming the pelvic inlet. This one is forming the pelvic outlet. In the normal position of the pelvis, where if someone is standing in anatomical position, which means the correct position, the pelvis is oriented in such a way that the anterior superior iliac spine and the pubic tubercles, they usually lie within the same vertical plane, and then the tip of coccyx lies within the same horizontal plane to the superior margin of the pubic tubercle. What about the sacrum? And the sacrum is usually facing, the anterior surface of the sacrum is directed downward and forward. This is how the pelvis sits. That's the normal position of the pelvis. Is there any difference between the male and the female pelvis? Yes, we have a lot of differences between male and the female pelvis, and this is because the female pelvis is adapted for vaginal delivery, passing babies, and a lot of these differences are accounted by that factor. So number one, for example, we have the pelvic inlet. This is the male pelvis, this is the female pelvis. Now the pelvic inlet is smaller in male pelvis, smaller and usually heart-shaped in male pelvis, but it's usually wider, round or oval in female. The sacropromontory usually prominent in male pelvis, but it's less prominent in female pelvis. And this prominence is what accounts to the heart shape of the male pelvis. What about the ischiospine? Ischiospine are usually prominent in male pelvis. You can see they are prominent, they are projecting inward, they are limiting the cavity. But you see, in the female pelvis, the ischiospine, they are usually shorter, and they are not that prominent. Also, take a look at the coccyx. The coccyx usually curves inward in male pelvis, but in a female pelvis is less. Does not go to that extent. Take a look at the subpubic angle. The subpubic angle is narrow in male pelvis and is wider in female pelvis. But what about the height? Look, the male pelvis is usually longer or taller or deep than the female pelvis. This is usually narrow or small or short, and this makes it suitable for passing babies because you don't want the baby to go through the long canal. You actually need the short canal. Now I've put side by side table here to compare the difference between male and the female pelvis. As you see, we have a lot of these differences. You can take your time, but the most important one that you can never miss You have the pelvic index, as we've said, in the male is heart-shaped, in the female is oval or round. We have the pelvic out, is usually small in male pelvis because of projection of the ischiospine and the tip of coccyx, but in female pelvis it's usually large. What about the subpubic angle? The subpubic angle is narrow in male pelvis, usually less than 70 degrees, but in males, in females, it's usually wide. More than 80 to 90 degrees, goes to even 100 and so forth and so forth. What about the ischiospine? We've said they're prominent in male pelvis and less prominent in the female pelvis, and have some other features. For example, the greater sciatic notch is narrow, and even the general build-up. The male pelvis is usually heavy, thick, and strong. Heavy, thick, and strong because of these male hormones. In female, they are usually lighter, thinner, and smoother. Okay, we've already seen. We have a lot of difference that can take your time to discuss, but these are the never miss. The sacropromontory is not mentioned here, but you remember the sacropromontory is prominent in male pelvis and less prominent in female pelvis. Let's talk about the joints of the pelvis. The primary joints of the pelvis that you know, we have the joint that are joining these pelvic bones anteriorly and posteriorly. Anteriorly, they've been the two pelvic bones have been connected by the pubic symphysis. As we've said, this is secondary cartilaginous joint, and then posteriorly they are being connected to the sacrum. So we have the joint between the ilium and the sacrum, and this is called the sacroiliac joint. The joint between the sacrum and the ilium on this side, and sacrum and ilium on this side. This one is modified synovial joint. It's a modified synovial joint. But we have some other joints like the lumbosacral joint, a joint between the sacrum and the lumbar, the lumbosacral joint. We have the sacrococcygeal joint, the joint between sacrum and coccyx, joint between sacrum and coccyx. Let's talk about ligaments, and these ligaments are strengthening the mentioned joint. The sacrotuberous ligament, meaning is coming from the sacrum to the tuberosity. This is the sacrum, and this is the ischiotuberosity. This ligament is coming from the sacrum to the ischiotuberosity. It's called the sacrotuberous ligament. We have a ligament which is called the sacrospinous ligament. This ligament is coming from the sacrum to the ischiospine. It's called this sacrospinous ligament. You have the sacroiliac ligament. This ligament is coming from the ilium to from the sacrum to the ilium, the sacroiliac ligament. And then you have the iliolumbar ligament coming from the iliac bone to the lumbar vertebra. Alright folks, this is what I had for you, and if you have question, additional comments, you can always swing by, and see you real soon.